Hello, hi, my name is Rachi Jain. I'm a counseling psychologist, and today we have with us Dr. Sowmya, a psychiatrist here at Mibo. Hi, Dr. Sowmya.
Hi Raji, how are you?
I'm doing good. How are you?
I'm good.
So, we're here today to ask a few questions to our psychiatrist. These questions have come in from like the general audience, and we'd like to know a little about the psychiatry.
Okay.
Yes?
I'm ready.
Yay! Okay, let's go. So, Dr. Sowmya, tell us who is a psychiatrist and what is their role in the mental health sector?
That's a really good question. So a psychiatrist is essentially a doctor who has finished their MBBS, and after that they've chosen psychiatry as their specialty. So what is their role in the mental health? So they can diagnose people with mental illnesses, they can give treatment in the form of medications, they can suggest various therapies to them, and they can also help with prevention of various mental health conditions.
Thank you so much, Dr. Sowmya. Who do psychiatrists generally cater to?
Okay, so psychiatrists cater to a wide range of people with mental health problems. It can be something like neurosis, depression, OCD, anxiety. It can be people with personality problems like borderline personality and paranoid personality, or it can be people with psychotic problems like schizophrenia, schizoaffective disorders, or mood problems like bipolar disorders.
Next question. How would you differentiate between a clinical psychologist and a psychiatrist in simple words?
Yeah, like I said before, psychiatrist is essentially a doctor who has chosen psychiatry as their field. They can diagnose mental illnesses and they can prescribe medicines, which is very specific that only a psychiatrist can do. Whereas the psychologists have completed graduation, post-graduation and MPhil if they're clinical psychologists, and they specialize in therapy and they can also diagnose mental health problems.
So this next question caters to some aspiring doctors. So Dr. Sowmya, tell us, if someone wants to pursue a career in psychiatry, what are the steps for it?
If you have given it some thought and you've finally decided you want to become a psychiatrist, so first I would recommend do some internships or some observations in places and see if it's really for you. Ideally during your internship period, during your MBBS. If you feel like it's really for you, then you can go on to do your post-graduation either from India or abroad, and then you'll be qualified to become a psychiatrist.
Okay, so a common question that is usually asked is, how do they start off? So do they have to take science as a subject in their PU or degree?
I think it's different in different states. From where I come from, there was something called BIPC, which is biology, physics and chemistry. Some states do have a mix of everything, including mathematics, biology, physics and chemistry. And then later, based on their rank, they can decide the field that they want. So it depends on the state that you're in.
Right. You prescribe a patient the necessary medications, but he refrains from taking them. What would you as a psychiatrist do in such a situation?
Okay. That's a very good question. Firstly, I'll try to understand why the patient is refusing the medication and if I can do something about it. And later on, I'll try to discuss various treatment options with them that are available and try to get the consent of the patient so that it can become a more client-centric approach. But in serious cases like schizophrenia, if they do not have the capacity to make assessment for themselves, then as doctors, we can pitch in and advise what is medically best for the patient.
Thank you so much. Are the medications prescribed by the psychiatrist to be taken lifelong? That's a common question that's been asked all around. In fact, with all the people that go through some sort of mental illnesses, the families are pretty concerned on this.
So there are some medicines that need to be taken lifelong, again like in mood disorders and schizophrenia, okay? But there are so many medicines that need not be, like for example, if it's first episode of depression, then something around 3 to 6 months would do, even for anxiety. It depends on the condition really. So it's for the prescribing, it's for the doctor to decide what's best for the patient with their consent, obviously.
Okay, so Dr. Sowmya, in the case where a patient is not responsive to treatment, what are the alternative approach that you take?
it's a very common scenario that we go through in our day-to-day lives. So usually first time when they're not responsive, our medicines take around 2 to 6 weeks minimum to show their complete effect. So wait and watch will be the first best policy, and if it's still not working, then we try to augment them with another medicine from the same class of medicines or from a different class, and see if that's working. And even if that's not providing the response that we want, then we do have some procedures. All of you might have heard of something called electroconvulsive therapy. I know it looks very barbaric in the media, but it's actually a very safe and effective procedure, and when done right, it can show really good benefits. But during all of this process, it is time taking, and the family member support is utmost important, and the therapists and psychiatrists are always there to support the patient during this journey.
And we come to the end of our question answer session. So from all of the cases you've seen, is there a larger percentage of genetic illness or acquired illness? Why is there a difference?
That's a point of debate in psychiatry. Most illnesses usually have a component of both genetic, either a family member being involved, or they must have suffered some kind of insult during childbirth, and along with the acquired part of it, which is their environment and the stress that they have gone through in their life. Could be emotional stress, could be physical stress, could be stress in the form of substance use. So it's usually like a combination of this genetic component as well as the environmental component, the nature versus nurture, that usually like manifests as a mental illness.
Okay, one last question.
Yeah. You sound very excited for it.
Yes, a little bit. Okay, so one last question. How is it for you like to be a psychiatrist? Like, what does your day look like?
Okay. It's a very rewarding profession, and it's one of those professions which gives you a good work-life balance. You see patients, when you deal with a patient who is having psychiatric problem, you actually involve the entire family, and it is quite rewarding when you can actually heal them completely and the entire dynamic of the family changes. So it is beautiful. We do have our hard days, but it has been quite nice so far.
Thank you so much for answering all the questions. It was lovely having you here, Doctor.
Thank you, Raji. Nice talking to you.
Lovely. Bye.
Bye.